Thank you very much, Anton, and thank you very much, Professor von Braun, Michael Baumann, and Ulrich Ringborg for this kind invitation. I think we all agree that this third Vatican meeting is becoming the state-of-the-art of cancer policy dialogues now, so we really hope that we can continue on, as you said yesterday. It's really a pleasure and an honor to be here, and I will talk to you a little bit about the innovation gap within Europe, of course, focusing on my region, the Central Eastern European region. Let me start with this slide, which I've shown you before. It's coming from IARC, which is clearly setting the stage why we need to deal with this issue. As you can see, when it comes to mortality, it's really obvious that there's a major inequality problem within Europe. And of course, we need a lot of attention to pay to Central Eastern Europe in this regard. What are the major causes? You all know that apart from the individual collective behaviors and exposures to risk factors, access to early diagnosis and screening and effective treatments, I think everybody in this room appreciates that cancer research disparities has a lot to do with this fact. And as been shown yesterday by Richard in his presentation, as well as in his landmark paper in Lancet Oncology 2 years back, there's a real big gap in terms of cancer research output in Europe. And you can see that the green dots represent the research output in cancer that is coming from the Central Eastern European countries, and everything else is on the top, as you can see. This is a major issue because, as has been articulated and nicely shown by many speakers yesterday, including Simon, Tit, and Thomas, when it comes to cancer research, comprehensive cancer centers play a very important role. And cancer research, cancer diagnostics and care, as well as education, go hand in hand in these really important infrastructures, which really has a major impact on the outcome of treatment. And it has been shown in many publications, including Richard's and some publications from the OACI, that research is really an important factor when it comes to output. And for that reason, the OECI, which has been developing this accreditation and designation system since 2008, is even more focusing in the 4th edition of the quality standards that are being formulated as we speak here. It's been announced and it will be in practice very soon in technology transfer and utilization of research output in clinical practice, which I think is a very important factor. But if you look at the map of OACI cancer centers, you can immediately see that there's a big gap in Central Eastern Europe. Of course, in Germany, you don't see OACI accredited cancer centers because they have their own very robust system when it comes to quality control. But in Central Eastern Europe, this quality control is largely not present. Having said that, we have heard yesterday that there's a new program, the EUNet CCC program, which is which has it as a major aim to outreach and develop CCIs and comprehensive cancer center infrastructures in this region as well. But I think we all agreed yesterday that it's very important to not duplicate activities, but to build on what has been out there for a long time now and to try to create synergies and not more work for these centers. But it's really essential to have very proper quality control in the Central European region when it comes to cancer centers. And I think it's vital to have it established in a way that will be equal and very similar to what is happening in the Western societies. And I come here with a message from Professor Miklós Kásler, who was a previous minister in Hungary and leader for the National Cancer Institute for a long time, that his organization that he established a while ago, which is called the Central Eastern European Academy of Oncology, is willing to help in this outreach program if there is a need, and willing to provide a hand to make sure that the accreditation and the quality control system in the Central Eastern European region will be developed in a way that will be beneficial for these member states as well as for patients there. Another important program that was first announced at the first Vatican meeting, I remember, is the Twinning Partnership Program. We have heard about this before, but I think we need to talk a little bit more about this program, because ever since it was announced at the first Vatican meeting, 3 of these partnerships had been developed. And it's important to mention that these partnerships are actually operating on institutional funds. So the institutions put their own funding resources into these activities. And I have to say that I've looked into all 3 partnerships. They're all flourishing. And I just put here the example of the Hungarian National Institute of Oncology partnering with the Karolinska, which is really a success story. We have workshops organized in radiotherapy and precision medicine at both places. For example, even this year we had 3 already now. And we went so far that the director of cancer research, KI, Professor Elias Arner, now has his own laboratory at the National Institute of Oncology, which brings us a lot closer to each other. And we have very visionary ideas how to do it at a higher level in the future. So you've heard about this initiative. This was a coordination and support action, the ONCAN EU program, where we tried to set the stage for this federated European data hub. And an important aspect of this program was also to address inequalities. And I was in a luxurious and very honorable situation to lead that work package, which was dealing with inequalities. And without giving you all the details that we learned, one of the major messages that came out of this program was that twinning is really a success story in these 3 centers. There's a lot of willingness in other centers to create these type of programs. This can go very far. This can really create synergies between Western and Central Eastern European centers, and it doesn't cost a lot. So a little money allocated to these activities from the EU would actually bring a lot of benefit to the system. Another very important message of these initiative was that, as said by Danielle in her nice presentation, the first death valley, which is technology transfer, is where the major discrepancy lies within cancer research in Europe. In the Central Eastern European member states, the maturation level of technology transfer offices is really, really below the ones that you see in Western societies. So there's no surprise why there's very little, very few drugs that are, and technologies introduced to the market in clinical practice that are coming from these countries. Now, I list here all the programs that we and my center are participating in the European scale. You can see we're participating in a really large number of EU programs, thanks to the Europe Beating Cancer Plan and the Cancer Mission initiatives, which are now really nice, large budget initiatives. But I would also like to point out that these are mostly cancer policy type of activities, and we have very little, if any, possibility to have money allocated for infrastructure development, developing the cancer research infrastructures at cancer centers, as well as for actual real scientific activities, which I would love to see. So this was one of the topics at the current policy dialogue that was held at my institution a few weeks back with the participation of Manuel Heitor, Patrick Rossi, and others from the room. And we had some really important messages that will come out from this dialogue. But most importantly, it was recognized that the heavy lifting has to be done by the member states when it comes to implementation of cancer research into clinical practice. And I was very fortunate to be able to bring these 2 people who are sitting at the middle of that table to this dialogue. And they were representing 2 ministries. One of them is represented the Research and Innovation Ministry, the other one, the Healthcare Ministry. So we started a dialogue between these 2 different worlds, and I think it's very important for the future so that they understand how implementation of research and research results into clinical practice will benefit cancer patients and the country as such. So we're in a luxurious situation now because the Ministry of Innovation has this vision that apart from scientific impact, economic and social impact is very important. And they also have oncology as a focus area within their activities. So we took advantage on that, and we submitted proposals which were funded, and these are large consortial programs that were initiated back in 2019, which I have to say transformed cancer research in my institution and in my country. And I would like to bring your attention to this large initiative, which was the National Laboratory Initiative. The name is coming from the US, of course. It's a lot lower scale initiative compared to what you guys have there. But the idea here was also to have knowledge centers that can become scientific hubs in areas with high potential to boost the national economy, and of course, those that are very important for the society. And so within this program, we established the National Tumor Biology Laboratory Program, which is the one that is dealing with oncology, and I'm in the position of leading this program. And this has become very important in our activities because this allowed us to create unheard synergies between clinicians and basic scientists in my institution and in my country. And now these people are working together, and scientists have their questions asked by the bedside, and the clinicians are actually showing up in the lab, looking after the results that we generate. And there are 3 sub-programs in this initiative. The first one is dealing with data. The National Cancer Registry is one of the topics within this one. And the other one is building a national database, including the National Genomic Database. The second sub-program is dealing with technology transfer. We really wanted to create this innovation chain within our system. And the third sub-program is developing or integrating the cancer research into the clinic. It's not a huge consortium. We have approximately 60 established senior scientists and about 100 young investigators, but we have a large outreach program and a lot of collaborations internationally. So what were the real important results that came out of this initiative? I thought I'd bring you some to show that really a difference can be made when you have money in the system. With a very nice collaboration with IARC, and thanks to Elizabeth and her crew, we managed to really reconcile the database of our National Cancer Registry with the National Health Insurance Fund and the National Statistical Agency databases. And I have to say that now we have a very nice, very clean, and very reliable database, which now allows us to do important epidemiological studies based on this database. Within this program, we managed to establish the National Molecular Tumor Board, which I think was very important. We see very visible results in the diagnostics of hereditary tumors within the country, as well as in the personalized therapeutic approach and patient pathways. We established the innovation chain, which means that now we have a strong technology transfer program, and we have very strong drug development programs, which we haven't had before. We were doing very well in basic science and in clinical science, but this first Death Valley was really a very deep one, as it is in many other countries in our region. And we also started to integrate AI into the diagnostics. We take this to the next level within the next phase of the program, I hope, and our results are actually implemented into clinical practice. We can show that now. I cannot stand not showing you at least one scientific side. I'm a scientist. This is coming out from my research laboratory, and with a very unique technology that we developed, we actually started to look into targeted metabolomics in this particular condition, where in melanoma you have the BRAF V600E targeted therapeutic intervention, where it's a huge problem with the drug resistance development, and we were able to pinpoint really important vulnerabilities in the cancer cells within this program. And I'm happy to say that we are now developing those, and we have new identified targets to the clinic. So coming to the end, we have a long-term objective and a business model. We have now a very nice centralized tumor bank, which we would really like to utilize for future research purposes. The same is true for the databases that we developed within this program. We have now validated diagnostic protocols, and the National Tumor Board, which allows us to do a more serious stratification of our patients and gear it up for personalized therapeutic pathways. And of course, we started to collaborate with industry, and we really would like to take our drug development program to the next level. And with that, I would like to thank you for your attention.